And Americans over the age of 50 are now able to roll up their sleeves and get a second booster shot if it's been at least 4 months since your last booster shot. This comes as the White House launched a new website to give people access to a one-stop shop for information about vaccines, testing, and treatments. ABC News contributor Dr. Alok Patel joins me live now to talk more about this. Dr. Patel, thanks for being here. Who do you think should really be focused on getting this fourth dose? Is this for everyone?
Well, Diane, thank you for having me. It's good to be here with you. And it's not for everyone. I know there's a lot of confusion out there as people are questioning whether or not they need to run out. But the CDC, federal regulators, and public health officials are pretty clear that if you're above the age of 50 and you have underlying medical conditions, especially one that might weaken your immune system, this is something you should definitely consider. And if you're above the age of 65, based on what data currently suggests, you should actually go out and get one if you meet this criteria. But if you're 50 and healthy, it's kind of an individual-based decision. And if you're under 50, there's no indication as of right now that you need to go out and worry about getting a second booster. Still, the most important thing to do, what all the data really supports, is that people get their primary series, especially that first booster, which under a third of Americans have actually gone out and gotten.
It feels like every time one shot gets authorized, it's not too long before we then start hearing about some other window opening up, either another shot down the line or that shot becoming recommended for more and more people. So do you think this fourth booster is going to become one of those things that we are all recommended to get?
It's too early to say if we're all going to get recommended to get that, Diane. I don't think it's necessarily a conversation if we're all going to need to go out and get the second booster right now, but more, are we going to need another booster in fall? Are we going to need a variant-specific vaccine? And that's what some scientists are really eyeing right now. But I think the point you made is spot on. There are people who are rolling their eyes right now and saying, I feel like we were just told whether or not to get the first booster. What's happening? And what's happening is that we can't seem to decide on what the actual goal of immunizations is. Is it to prevent symptomatic illness? Is it to prevent widespread mild disease, or to prevent hospitalizations and death? Because if we look at the latter, preventing people winding up in the ICU on mechanical ventilators, we have clear-cut data that even during the Omicron surge, 2 shots plus a booster were better than 90% effective at preventing that. So that's why I think this is going to warrant a little bit more nuanced discussion, and why there actually are groups meeting next week, including the CDC, to actually sit down and talk about this second booster, just to make it straight and clear for all those people out there who have questions and are now wondering when this is going to end.
Now, I have gotten a lot of questions, and I am not a doctor, so this is why I pose them to you, about whether or not at some point getting too many vaccines can actually decrease the immunity versus boosting it. Is there any concern among the researchers looking into this that this could backfire at some point?
Well, Diane, people are asking you some pretty insightful questions.
Yes.
And you basically are, an expert by proxy at this point.
This is why I have you.
There is a theoretical risk that I've heard some of my colleagues in infectious disease and immunology concerned about, is that if you give your immune system too many vaccines, it's not that it's going to have a negative effect, but there's going to be marginal returns, especially if it's within the 4-month window. Are we really going to see that much of a gain? And then what happens in 7-8 months from your first booster? Are we then going to look back on the data and say, oh my gosh, we should have waited for the second booster? That's why people above the age of 65 who have weakened immune systems, and it's been 4 months, there may not be any need to wait. But people who are on the fence, people who are healthy, it actually might be a good idea to take a step back and say, hold on, maybe we can wait a little bit to see what happens in summer, and then I can make a more informed decision.
And what do you make of this new one-stop, quote, one-stop shop, the COVID.gov website announced yesterday? 2 years into the pandemic, do you think that this can make a big difference now?
Basically, I'm like, where have you been all my life, to this website? Because it's one place that we can refer to people. Now, yes, it is very late in the pandemic, but I think the timing is actually still important, because we're moving to a place where people are being asked to take on their own individual risk to manage this moving forward as we find this new normal, which is a completely different normal for people. And the best part about that site as of right now is that you can go on, type in your website, and you can look to see where that test to treat option is near you, which I think is going to be very important for people out there who are still worried as we start to open up.
All right, Dr. Alok Patel, separating fact from fiction for us. Always great to have you. Thank you.
That's how we roll, Diane. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.